Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. Aging Insights is produced by the New Jersey Foundation for Aging. Each program we've developed over the last 2 years has a primary focus to connect boomers, caregivers, and seniors to community-based programs or to address relevant topics. Heart attack and stroke are life and death emergencies. 1.5 million Americans each year have a heart attack without any warning signs. So we want to focus on prevention and what people need to be aware of in order to promote heart health. Today we have 2 guests who will help us to understand the ways to prevent stroke and heart attacks. We have Mr. Bill Dailey, who's a stroke survivor, and we have Bonnie Arkus, who's a nurse and founder and executive director of the Women's Heart Foundation. I want to thank you both for being here today.
Thank you for having us.
That's great. I think this is a very important topic. Bill, since you're a stroke survivor and I know that you sort of have developed a passion, would you share some of your story with us?
I am an advocate for stroke awareness, and I've been a volunteer at Atlantic Health's Stroke Rehab Hospital for about 7.5 years. I had open heart surgery in 1993, which resulted in triple bypass. I've had 4 surgeries for skin cancer, and in 2003, I had a massive stroke, one that kept me hospitalized for 86 days. But as you can see, even with all that trauma to my body, I'm still one heck of a good-looking man.
Thank you.
Now, with that in mind, as my rehab continued, I decided that I came to realize, I should say, that there were so many people that had no idea what to expect when they had a stroke, or what the signs were, what the symptoms were, how to handle the particular situation if you were having one, or you were with someone who was having a stroke. I then decided to maybe just arbitrarily pick up the phone at random and reach out for different groups, senior groups especially, and see if they had a inclination to let me come to their groups and discuss stroke and stroke awareness.
That's how you reached out to me.
That's exactly. That's how I reached out to you.
That's right.
And that's how I drove you nuts with the phone calls. So what we then did, we were so very surprised. We were greeted with open arms. Everybody was sure we'd love to have you. Unfortunately, there are so many groups we could have reached out for that don't make it available to the public or to myself as being the public, how I could reach out for them with phone numbers, with websites, et cetera. But in the last almost 3 years, we've spoken to over 107 groups in that time, and we've spoken and we're in attendance. We've had some 6,500 attendees. Well,
I think that's very impressive. Can you give our viewers an understanding of what a stroke really is?
Sure. Well, a stroke is a loss of oxygen to the brain caused by a blood clot, which is an ischemic. It's I-S-C-H-E-M-I-C, ischemic stroke. And the other type is hemorrhagic, which is where you'll have a blood vessel burst and flood that particular area of the brain with the blood that goes through, which denies the brain cells in that area for both the ischemic stroke and the hemorrhagic stroke the oxygen, the blood, and the nutrients that they need to survive.
So the damage is similar?
Damage is similar, quite so, yes. But 80% of the strokes are ischemic. That's a type that has a blood clot. There's only 10 or 12% that have hemorrhagic strokes.
We often hear the phrase, it was a mini stroke or a TIA. So can you describe how that is different from the other 2?
Sure. The TIA is a transit ischemic attack. What that happens to do is the stroke, the blockage may suddenly appear, and it masks itself as a real stroke. But those may disappear within 5 minutes to 24 hours. If you see the symptoms, you see the signs, it's not something that you should just minimize and say, well, it'll pass, it'll go away. The same type symptoms that you'll have in a regular stroke. So you want to make sure you've called 911, you've made contact with the first responders, and you go to the hospital just in case that particular stroke is going to escalate. But 9 times out of 10 with a TIA, they will leave and within 5 minutes to an hour, 2 hours at the most, I should say 2 hours at the most, within 24 hours, and then it's gone. But the percentage of people that have a full-blown stroke after they've had a TIA is very high.
I know you've mentioned some statistics. What is the incidence of stroke nationally? Do you know?
About 800,000 a year.
Well, I think that's why it's so important today that we're talking about prevention. And I think you have already identified some of the risk factors for a stroke. Are there any others that you want to add to that list?
Well, excessive smoking, drinking, obesity, of course, and then the main are high blood pressure, arteriosclerosis, diabetes, cholesterol. Those are the four main. And atrial fibrillation, you've seen on television, you've inundated in the last 3 or 4 months with different types of medicine for a company called atrial fibrillation, which is an irregular heartbeat.
Oh, okay.
When that beats indifferently, what happens is that at times in the atria, in the 2 upper chambers of the heart, instead of the blood flowing properly, it will pool, and when it pools, then clots become prevalent, and then strokes follow.
So what are the early signs of a stroke?
The early signs of stroke? Well, we use the word FAST as an acronym, F-A-S-T. F is for face. You might have blurred vision, you might have double vision. Your face will droop to one side or the other. Ask the patient, if you see that, to stick their tongue out. If their tongue follows the droop on either side, very good indication that it might be a stroke. Also a headache. Now, I didn't have that particular situation, but they tell me that the headache might be the most severe you've ever had, even more potent than a migraine. A is for arm. Ask the patient to raise their arm. If I raise my arm like this, it's haltingly with my bad hand, my right hand. Of course, this will shoot up. It tells you that there's a possibility that there's numbness there that they can't feel, or that arm, but it's unable to move properly.
It's frozen at that
Frozen. Both limbs, so usually on the right side or your left side, whatever it happens, both limbs will be affected, and they'll be affected immediately. At that point, if the patient should fall, don't bother to pick the patient up. Make them comfortable, but you don't want to call first responders and have them taking 2 people out to the hospital because you've injured yourself in picking them up. S is for speech. Speech, if I said to you, Grace, isn't it a gorgeous day out today? And you replied to me, the Knicks lost last night to the Cleveland Cavaliers. Well, how did you answer that question? And I asked you the same question, and you told me that Rachel Ray cooked a beautiful meatloaf on TV today. Well, obviously, you know there is something wrong, okay? Your speech is slurred. You can't identify the particular questions that were asked, and you may not cognitively be able to answer the question, or you might lose your speech to begin with altogether.
And T?
Is time.
Yeah.
I can't be more redundant. Time is of the essence. You can't call your butcher in Des Moines. You can't call your sister-in-law. You may not have the opportunity, once you dial the phone, to talk on that telephone. You need to be able to dial 911 immediately, then call whomever you want. But that first call is the most important, and 911 should be that call.
Well, I appreciate that. Are the symptoms different for a man or a woman?
Well, they usually all suffer the same type of symptoms. Women are somewhat different in the fact that instead of the numbness in their arms, their limbs, they may feel a pain in each one. As far as headaches are concerned, women are tougher. I just have to say, women are tougher. They're the first ones to call 911 now, we understand. I shouldn't say they're not the first ones to call 911. They'll hang on and I'll lay down, I'll be okay. Whereas the husband may think he's having a brain tumor, is running out the door screaming for help. Women just handle it somewhat differently psychologically.
Well, I appreciate that. I think you've already somewhat addressed how you educate the public, and I guess I want to ask you again, what do you think is the most important message in terms of the best outcomes?
Time. That word T in the word fast.
And the first responders know what to do.
First responders, from what I understand now, throughout the state, the first responders have been told that if you see someone, if your patient is experiencing stroke symptoms, they'll be taken to the closest stroke center that they can get to. Okay, maybe not the hospital around the corner, but the closest stroke center.
Okay, well, I think that's very important information, and I really thought it was important to have you and Bonnie here today because essentially, you know, we're really talking about heart health and a variety of other things. Bonnie, I think I want to really have you also share how you developed your passion and how you started the Women's Health Foundation.
Well, we had a interest in women and heart disease for some time now, since we have the Go Red for Women campaign, and we're Red for Women. But backing up to when I first became a nurse, I realized then that so many people women in particular were suffering stroke at a young age, and there was not a common knowledge about what was the cause of that. As it turns out, estrogen, taking birth control pills, and smoking was responsible for many women of childbearing age to be in the hospital bed when I was a neurosurgical nurse in Washington, D.C. suburbs. I also found a lot of African Americans in the clinic setting were suffering severely from stroke. So I became interested in why is it we don't know more about why African Americans suffer so greatly with this ailment. And then in 1986, I lost my mother from heart bypass surgery at the age of 60. And I realized they knew very little about heart disease in women and what was causing more women than men to die from heart disease since the year 1984. And the growing death rate in women, especially those undergoing heart procedures, being such a high rate of death. So I became interested for those many reasons and started the Women's Heart Foundation.
Why don't you give our viewers an understanding of what the Women's Heart Foundation does?
Well, in the beginning, we were all about education, and we're still about education, that heart disease is not just a man's disease. It has killed more women than men, as I said, since 1984. And the growing death rate in women is of monumental concern. The other item that we wanted to do is create awareness about gender-specific health care. Estrogen and testosterone affect every cell in the human body, and we need to be aware of how heart disease affects women and men differently, and how treatments need to be tailored to women and men specifically. In 1989, that's when we began our campaign. In 2000, we had our first gender care conference. The medical conference was attended by over 200 medical professionals. So we were off to a running start.
Yeah, exactly. I think it's very important to perhaps share some of the risk factors for heart disease, and if there are special signs and symptoms for women, please let's cover those.
Sure. Risk factors for heart disease include some that are not controllable, such as family history, number one, and of course age. Atherosclerosis is a normal part of aging, and you can't control your age, of course. And so we want to look at what makes atherosclerosis more of a disease process in younger people, what accelerates this, and what causes the blood clots to form in the case of stroke or heart disease. The high blood pressure is a very big risk factor, especially for the African American community. And you have to look at the heart disease as an inflammation inside of the artery walls. So all of these things we talk about with risk factors actually relate directly to inflammation within the artery walls.
Yeah, I was going to say some of the symptoms or the factors that Bill mentioned are very similar for a heart attack, whether that's obesity, smoking, poor processing of lipids, which is called dyslipidemia.
Dyslipidemia.
Yes, though I looked that one up, but anyway, and the dictionary doesn't really cover it. I will say that. You mentioned, Bill mentioned being obese or overweight. I mean, all of these are very similar risk factors.
Yes, they are. And you have to add unhealthy diet, which a lot of us are involved with these days because of our very hastened lifestyle. We quickly grab food on the run, and sometimes it's very unhealthy food. And the premature menopause affects women, of course, does not affect men. Estrogen and use of birth control pills, especially with smoking, is an extremely powerful risk factor for stroke and heart attack in women. And we hear a lot of advertisements on women taking birth control pills that are extremely risky for women having heart attacks and stroke.
Yeah, there's some new ads out there. I'm curious, what is the difference between a heart attack and a stroke?
Well, we're talking about the embolic or ischemic type of stroke when we're going to compare heart attack and stroke as being a blood clot that's formed. So we have a different part of the body affected, with the heart being having cells die off as opposed to stroke. So you're going to have different symptoms. But if you're talking about embolic stroke or a blood clot within the coronary arteries, you're going to have the same process inside the body occur. By the way, you could have a stroke to your kidneys, to your spinal cord, different areas, but
With
for
the
today's
blockage.
discussion,
With
yeah.
the blockage.
I know we're talking stroke to the brain or brain attack versus heart attack. So the other very important risk factor for women and men is metabolic syndrome, which is the central obesity that we're seeing a lot of people suffer from today. And we can do something about reversing that pre-diabetes state. And of course, race, we talked about African Americans being at highest risk for blood pressure being such an indicator of problems with hemorrhagic stroke with African Americans.
Are there particular, I know we've talked about so many of the risk factors. What about early signs of a heart attack?
Early signs of a heart attack, if we're lucky enough to have them, because 60% of women have death as their first sign of heart disease.
So let me ask, is that because Bill was mentioning that somebody might think, oh, it's just a bad day, I'll feel better, or is it because it comes on a little more sudden?
Well, that's a very interesting question, and one that we really need to intensify today for our purpose of discussion, because I do believe that women do have warning signs and they're ignoring them, as healthcare professionals are too, because they're so mild. It turns out more than 70% of women do have early warning signs of heart attack. 2 weeks before a heart attack, 70% of us have signs of the flu with mild chest discomfort, burning sensation, nausea. The women don't know quite what to make of it, but it turns out that is a prelude often for a heart attack in women.
So sometimes it's described as indigestion that they don't usually, or heartburn or something that they.
And severe weakness as well.
Okay.
Yes.
Interesting. So that's a gender difference. I don't think.
Well, some men have that as well. The other is that women have small vessel disease, they've recently found out. And also the plaque formation on women's coronary arteries is more diffuse. So even the gold standard test for women and men, which is the cardiac catheterization, has been misinterpreted as normal with women, just telling women, oh, well, you have smaller blood vessels. There's actually nothing wrong with your heart, when in fact more women are suffering from chest pain, angina pain, long-term without relief, and they're misinterpreted as being normal with their gold standard test of cardiac catheterization.
I think you've already sort of touched on the difference in treatment for a man and a woman. So is there something else? Obviously, as you're educating the public, you're also educating healthcare professionals.
Yes, that's true. And women are more likely to have poor outcomes with surgical interventions, such as heart bypass surgery and angioplasty. And the tools were made for fitting into men's larger arteries. Now, since we started our campaign back in '89, there has been some improvements in the technology and outcomes for women having these interventions. But they are finding women do better, for the most part it seems, with medical approach to expanding the artery's blood supply to the heart muscle.
When you say medical approaches, are you thinking medication or are you thinking instrument?
Medicine and lifestyle changes.
Okay.
Dr. Dean Ornish found from his healthy lifestyle clinic in Sausalito, California, that women do respond better to healthy lifestyle changes than even men in improving blood flow to their heart muscle.
Interesting. So is a woman's risk increased after menopause?
Yes, it is known that women are seemingly protected by estrogen. Estrogen relaxes the vessels and provides more blood supply to the heart. And estrogen also increases the HDL, the healthy cholesterol in the woman's blood. So after menopause, you don't suddenly drop off a cliff with your risk factors increasing, but gradually over a 10-year period post-menopause, then a woman's risk factors for heart disease are equal to that of a man's.
Well, I want to be sure that we talk about prevention. I know you've both sort of touched on a little bit in terms of the risk factors, but I think that we should maybe get a little bit more in the details here. And then before we close the show, I want to be sure people know how to contact you both, since you're really very committed health educators. So Mr. Dailey, why don't you give us a sense of what you cover when you do a program?
Sure. As Bonnie had just mentioned, diet is one, of course. Change of lifestyle, number 2. Exercise, number 3. Now, I didn't bring all of the materials, but I didn't bring that for a particular reason, because everybody should be their own advocate. And after I had my stroke, if I had somebody feeding me all the information I needed, making all the phone calls I needed, I just never would have progressed as far as I should have. And I hope people hear this, understand what I'm saying. So if one picks up the telephone and dials or Googles on their computer, as an example, I'm going to take a step back to disparities. Because if one Googles the National Institute of Health, which is in Bethesda, Maryland, they will offer to send you different brochures that they have on a lot of the topics that we touched on, and especially the disparities in ethnicity. So you could call them, they'll give you a list of the different, and here I go again, they'll give you a list of the brochures and the pamphlets that they have, and they would send that to you. Now there's a young lady, as far as exercise is concerned, there's a young lady from Seattle, Washington. She does a program on most cable TV stations. It's called Sit to Be Fit. And if you find yourself not in a position to walk, which is the best exercise of all, 30 minutes a day of just, regular walking, you can sit in a chair, follow her on television with straps that she may use or a ball that she may use. And if you're unable to complete the normal exercise as you would with your limbs maybe not strong enough, you can sit in the chair and watch her and do all the different exercises that she does. Just getting that blood flow in your system is one great step in exercising and keeping yourself awake and keeping your body in tune.
And of course, we always ask people to check with their healthcare professional before they take on a lifestyle change or diet or exercise. And Bonnie, I'm just curious, as you do presentations, what do you emphasize in terms of prevention?
Well, the other item, I want to back up a little bit, because there was one other item I remember we talked about earlier about calling 911 and how you have to give your address, because a lot of people have cell phones or they're using the networks where your address doesn't come up on the phone automatically. So hopefully people will give their address. But we do stress prevention, being aware of your own controllable risk factors, number 1, and always being aware that chronic inflammation is a huge part of heart disease. So what do? We can control high blood pressure through medicine, through walking, through avoiding salt intake. And there is a discussion about sea salt versus the iodized salt, and sea salt, some people believe, leaves the body quicker. And flossing your teeth daily. They now know that chronic gum disease can be an inflammation factor for people, and keeping your gums clear of infection. Becoming a nutritarian is important. That's what Joel Fuhrman coined the phrase as, eating lots of fresh fruits and vegetables and making that dense type of nutrient available every single day will help reduce the amount of inflammation in your arteries and prevent the plaque from becoming stuck to the inside wall of your artery and becoming rancid. Don't smoke. We talked about smoking as being a risk factor. Limiting your alcohol intake to 1 drink if you're a woman, 2 if you're a man, and that's important for avoiding some of the irregular heartbeats related to excess alcohol intake, and keeping that to a limit. Be careful about medicines you're taking that are going to be a vasoconstrictor. That's very important. Walking every day, avoiding dehydration, drinking lemon water.
Okay, let me just interrupt for a second, because I know when we had our conversation, we talked about aspirin, and so I just want to cover that briefly. So, Mr. Dailey, you mentioned that an aspirin is not really appropriate for stroke.
Right.
Right, and yet for a heart attack, Bonnie, I know people sometimes suggest that as a preventative. So I just wanted to say there's a difference here, and people need to check that out. The other thing I just want to mention is I would imagine in restorative care that someone might need some psychological support. And so I presume there are support groups out there that we want to encourage people to connect to as well.
Definitely.
So I think that's, not only probably for the survivor, but for the family, the caregivers that are doing so much to help somebody get back to their best quality of life.
There are plenty of those available also.
Right, so I think that that's important. So I think we've really touched on a lot of things.
Could I just interject one thing that I left out, was
briefly.
that as far as the finding the different areas and I'm not going to put this in a proper perspective, but I just want to say that keeping in touch with your family doctor, with your primary care doctor, he is it all starts with him. Okay, you've got to be closer to him than you are to your own husband or your wife. That's where it all starts. That's where all of these risk factors are going to show up as prevention.
That's prevention.
Yes.
So I appreciate you mentioning that. I think knowing your own health situation is probably one of the better things that we can really stay on top of. So I appreciate you mentioning that. So as we close today's show, I want to be sure people know how to reach you. So, Mr. Dailey, what's the best way for people to reach you?
My website, which would be the word recovery preceded by the letter D. D recovery 2003 at AOL.com.
I appreciate that. Thank you. We'll be sure and put that on the screen. And Bonnie?
Yes, we have a website, womensheart.org, and on that website we have a personal risk factor quiz for women, and we invite all women to learn more about their hearts and take the first step to take care of their hearts.
Wow. I appreciate you saying that. So I'd like to remind our viewers that we encourage them to contact their healthcare professionals to learn more about prevention and to determine the best way they can pursue their own heart health. So I'd like to thank you both for being here and for sharing your time with us today. And we also appreciate our viewers who are tuning into this show. Aging Insights is produced by the New Jersey Foundation for Aging, and to make donations to the foundation or to become a sponsor for Aging Insights, please go to our website at www.njfoundationforaging.org or call our office at 609-421-0206. We also have an online survey for Aging Insights, and feel free to put your comments there about the show and to suggest other topics in the future. We want to remind you to find out about senior services in your area. Please contact your County Office on Aging, also known as your Aging and Disability Resource Connection. You'll see a listing of their numbers on our website, or you may call the state hotline at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.